Good afternoon to you, and welcome to another edition of the Young Voices Forum. I'm so glad that you people made time to join us today too. So on today's episode, we are discussing sexually transmitted infections, STIs. What is the scope of the problem? We are fortunate enough to have a nurse from the Tamale Central Hospital to aid in our discussion. This program is brought to you by Savannah Signatures and supported by UNICEF Ghana. And you can leave your questions and your suggestions and your comments in the comment section, and we would address that when the need arises. So, zooming straight to our discussion, welcome, madam.
Thank you.
We are very glad to have you here today.
So happy to be here.
Yeah, so we've had sexually transmitted infections. We've been hearing it, but I think that the meaning a lot of times it's not so clear to people. So I want to ask, what exactly is sexually transmitted infection?
Thank you for your question. When we say sexually transmitted disease, what we just mean, the simple way I can say is that acquiring an infection through unprotected sex with an infected person. Because we cannot say it's sexually transmitted disease without mentioning unprotected sex. So they are the key things we are looking for: unprotected sex and with an infected person.
Yes.
Yeah.
Okay. So yeah, I guess this is so clear for a lot of us now. So if it's not gotten through unprotected sex, then it's not a sexually transmitted infection. Okay. So talking about sexually transmitted infections, what are some of these infections?
We have a lot, but I'll just mention the most common ones that we have around.
Okay.
We have gonorrhea, we have HIV, we have syphilis, we have vaginal wax.
Okay. So I see that you brought a book. So I'm thinking that it probably has pictures of some of them. So viewers' discretion. We are going to show some images that some people might find gory. So please be on the alert. And if you are uncomfortable with seeing them, you can just skip this part and get back to the discussion later on. So, madam.
So when you look at this picture, this is it's a sign of gonorrhea, because you see the penis, you see the whitish discharge. And then when you see the female organ, you see that there are discharges, whitish discharges. So these are signs. This can tell us that you are having gonorrhea. But we don't take only this. We'll let you do further investigations so that we'll be sure that this is the condition you are having. And then sometimes you see, these are also signs of gonorrhea. You feel people having swelling around the nips, and it should tell you that come for help. These are growth, vaginal wax. These are vaginal wax. You could see that there are growths on the penis and then around the vulva area. And these ones, a lot of people hide this. When they see it, they try to hide it. They don't want anybody to know. They don't want anybody to see. So by the time they come, it has advanced. But if you come early with this, we could help you manage. We can't cure this, but we could help treat the symptoms you bring. And then these are some signs of herpes. Herpes. These are also some of the signs. You see some balls in the vulva area, and you could see there are some rashes around the testis and under the penis. So these are some of the signs we can see, and some of the types we have.
Okay. So that's all. Okay, thank you very much. So STIs, what are the main causes of STIs?
Thank you very much. The main causes is one, unprotected sex.
Okay.
Unprotected sex with an infected person. And I always say that, how will you know that this one is infected and this one is not?
Yeah.
Because you cannot look at somebody's face and say this person is not having an STI.
Okay.
So I always say that, so far as you don't know, you must be sure of what you are going into. And I always say that, for me, for young ones watching us, my sisters and brothers, young ones watching us, abstinence should be your number one choice.
Okay.
Because the causes that I will tell you, you cannot see. If I tell you that don't have sex with an infected person, how will you know? So that is one cause. You are having sex with somebody who you don't know the fellow is having. You are not using a condom, so the sex become unprotected. If she's having any form of STIs, he or she can pass it to you. That is the number one cause. And then number two cause, we have some STIs that through a parent can give to a child during delivery, such as syphilis. If a mother is having syphilis and is not well treated, the mother can pass it on to the unborn baby. So in that form, it's not your fault. Your mother has passed it on to you. So you can get it through birth.
Okay.
And then we have sometimes alcohol and drugs. You are taking a lot of drugs. You are taking a lot of alcohol. You are always drunk. Sometimes they get raped because they don't even know where they are. And so far as you don't even see the one you are having the sex with, how sure are you that the fellow is not having STIs?
Okay.
So these are some of the things that can predispose us to get STIs.
Okay. So what are some of the effects of STI?
For STIs, depending on the type you have, especially, let's say, let's just pick them one after the other, like gonorrhea. One, some of the effect is infertility, because one, you have it, you sometimes we don't even detect it early, especially with the females. Females can have gonorrhea and it can go on and it will not show signs. Okay. So by the time you know that you have gonorrhea, a lot of things have happened in your system. Oh, okay. And if you don't seek for care early, you can have infertility problems.
Okay, so let's just backtrack to the gonorrhea quickly.
Okay.
So how long can gonorrhea go undetected in females?
With females, it depends. That is why I said it depends on your immune system.
Okay.
If your immune system is down, you can get... I know somebody who had gonorrhea for 5 years, 4 years, before it showed signs.
Okay.
Because with the female, the way our canal is, it's difficult for you to get, at least, show the signs. Okay. But with the males, when they get, it shows instantly. Okay. After the sex, he's going to urinate, he feels painful sensation. Okay. That is it. He has shown the signs. But for we female, because of our reproductive system and the location, it's difficult for you to get the signs early. And therefore, we all say that it is if you get the signs, if you are observant with your body, maybe the vagina discharges, maybe you feel some burning sensation when you are urinating, come, and then we'll let you do the test. And when it's found early, you get treatment.
Okay, so still on the effects of STI.
Yeah.
Yeah, you were mentioning before, I keep back to the gonorrhea.
Sometimes with syphilis, you can get blindness, especially with the children that get it from their mothers. If you are pregnant, in the ANC unit, when you are pregnant, we try to do that test for you. It's a compulsory test. Okay. Because if it's detected early, we can put you on antibiotics, and then when you are delivering, the baby will be safe. But with the pregnant woman, if you don't come, and then sometimes some of them, you are pregnant, you don't come for antenatal, so we miss them. So if such a mother is having syphilis, during delivery, the infection can be passed on to the baby, and sometimes it affects their eyes, they become blind. Okay.
So if you just joined us, we are discussing STIs, and we have a health professional in the studio helping us with the discussion. If you want to add anything, if you have any questions or any comments, you can just leave them in the comment sections, and then we'll address it when we can. If you tune in, this is the Young Voices Forum, and we are discussing STIs. So still on the STIs, can all STIs be treated?
No.
Wow, okay.
No. All STIs cannot be treated. There are some that will only treat the symptoms you bring to us, but we cannot cure you.
Cure.
It's what I'm saying is that if you come with HIV is a sexually transmitted disease.
Okay.
And you know it is an immune disease.
Yeah.
So if you have the infection, what we do is that we manage the symptoms you present, but we cannot cure you from HIV.
Okay. So currently HIV is the only STI that cannot be cured, or do we have other STIs?
And some, we have hepatitis.
Okay.
Some people are saying they have treatment. If you go to social media, I have the treatment for hepatitis. So we say we'll manage the symptoms.
You can't cure.
We cannot cure. No drug, like in the hospital, we have a drug that can cure hepatitis. No. That is why we always say that with hepatitis, if you are negative, go for help. There is vaccines that you can protect yourself with. And then I think it's given 1 month in a gap for 3 times. And then every 5 years, you test. If you are negative, you go in for that. And that you are protected from getting hepatitis.
Okay.
So with HIV and hepatitis, no. Vaginal wax, we can't treat you. We manage the symptoms. That's what I show you. The rashes around the vagina and all over. So we treat the symptoms for you, but we cannot treat you. With gonorrhea, if you come early, we treat you on antibiotics, and you are done. You are cured.
Okay.
If you come early, gonorrhea can be treated, and you are good to go. But sometimes they don't come early. If you delay, we will treat you, but it may have a lot of effect on you.
Okay.
So what we say is that it's not all STIs that can be treated. There are some we can treat, like what I told you. We have syphilis can be treated if you come early. Gonorrhea can be treated if you come early. But when we have hepatitis B, hepatitis C, we have all the groups, hepatitis group, and then we have HIV, which cannot be treated. We only manage the symptoms as they present.
Okay. So there's been a lot of talk about symptoms, and I just want us to go over what can one know. What can happen in one's body that the person can begin to feel like, I think I have contracted an STI?
A lot. And I'm happy that you've invited us to share this to the young ones. I always say that knowledge is power.
Yes.
And if you have knowledge, you have everything.
Okay.
And with STIs, you normally, as we went there, I want to come back, the vagina itself should not be dry.
Okay.
God has created a normal flora for the vagina. So in the normal sense, as a woman, your vagina should not be dry. God has given the whole place the natural enzymes to work.
Okay.
And therefore, if you're a lady watching me and you have observed that there are discharges coming out of your vagina, is smelling, you know that this kind of discharge, no, I've not had it before. It's now that I'm seeing it. Sometimes it's so offensive. It comes like a rotten egg. These are some of the signs. If you are a lady and then all of a sudden you have abdominal pains, you don't have it before, but all of a sudden you have pains, seek for help. These are all signs. You are a lady, you are there, and then all of a sudden you don't feel well. You don't feel well. Sometimes you yourself, when you are walking in your panties, you should feel well there, but you realize that I'm in my panties, I don't feel well, I don't feel normal. Come to us. There is always help. And sometimes you have bled the normal bleeding, you know your pattern. All of a sudden you are spotting. Today I'm seeing blood. Then it stops. Once in a while you remove your pants, there's a spot. Come to us. These are all signs that is showing that there may be an infection. When you come, we do the investigations for you. And then if you are free, we educate you. And then if you are positive, we treat you.
Okay.
So these are some of the signs. And with the male, sometimes when they are when you are urinating, you shouldn't be feeling pain.
Okay.
But sometimes you are urinating and all of a sudden it ceases.
Okay.
You feel that the urine has ceased, and all of you feel sharpness around that area. Seek for help. And sometimes you also feel lower abdominal pains. These are all signs. Sometimes strange rashes. Strange rashes. You've never experienced that before. These are all signs telling you that there's a problem.
Okay.
Yeah.
So talking about the whole testing, I want to know, if one wants to test for STI, is there a general testing method that you can just test that covers all the STIs, or does one have to do individual tests for each of the STIs?
Thank you for this brilliant question. Normally when you come, we have the system. Every hospital have a system which it operates. So we at Central, we have the OPD system. So if you are pregnant, it's different. If you are pregnant, you go to the antenatal and then you tell the midwife your problem, and then they refer you to see a medical person. Our antenatal place, we have a medical person handling pregnant women. So you go there. But if you are coming in as maybe outpatient, then you go through the OPD, through the consulting room. Then with the signs you are telling the medical person, he gives you a requisition for you to do the lab.
Okay, so what I want to find out is, so it means that there are different tests.
Different
tests for each of
the. Is different.
Okay,
syphilis test is different. HIV test is different.
Okay. So there's not a single way
that you can do
one test
for all. No. They all have how they work. So we can't have one particular test running for all of them. So we have different forms.
Okay. So if one wants to check if they have STI, then it means that you are going to run a series of
investigations.
Oh, yes. Okay. That is really clear now. So on how long do STIs take to heal?
As I earlier on I said, depending on the type of STIs that you have, like gonorrhea, if you come early, at least they put you on maybe 14 days antibiotics and you are covered. I told you HIV, we don't have cure for that. So you are on the drug till you will just be on the drug for life.
Okay.
Yeah. So we don't have a specific time of, depending on your immunity. Some can come, you put them on antibiotics and they are fine. 3 days, 7 days, they are up. Okay. So depending on your immunity, that can help you for your healing. So I cannot say specifically that generally, maybe 7 days, everybody coming with gonorrhea, if treated 7 days, you are covered. Depending on the makeup system, that will determine how you heal.
Okay.
Yeah.
So how can young people prevent STIs?
Okay. With young people, I deal with young people. I deal with adolescents. I deal with it's my passion, because I realize that they need information, and we have failed them as health people, as media people, as parents. We have failed them in every way. Parent is not telling a child the right thing. The grown-up is not telling the young one the right thing. We are all, it's like they don't need to know. And I always say that for a young person, it's better we give them the information. It's better we let them understand the truth. It's better we let them know the rules and the regulations. Because if we do that, it will help our generation. And I always say that the young people are all that we have, and they are our generation. And if we give them the right information, we'll reduce a lot of complications that will come their way. For an adolescent or a young person watching me, I always say that the number one prevention of STIs is abstinence. Abstinence is everything you need as a young girl, a young boy coming up. Because you may not know who you are having the sex with. You may not know that the fellow is having. And sometimes I say that what they give you, the fried rice they give you, the iPhones they give you, the monies they give you, if you sleep with a man who you don't even know anything about, after doing it and you come out with STIs, he has gone, but your future is doomed. So I urge the young ones that abstinence is everything, is key. It should be what you long for. It should be what you long for. So the number one thing is abstinence. The number two is using condom. And for condom, I always have a lot of issues about it because young ones are not even careful when using condoms because they don't even know that at least the penis is supposed to be hardened before you put the condom on. So even the foreplaying, sometimes the men enter before they even wear the condoms. So the education to the condom use is very important. You can't just get up and say you are using condom. You can use condom and it will fail you. You can use condom wrongly. So condom use is very important. How you use it, you should know the expiring date on it. You should always check the expiring date. And then you should always wear it well. You should always wear it well. And you can't use condom. Sometimes they say every one run, somebody can use one condom and then remove it down, another run, then you put it on. It doesn't work like that. These are the information you should have. One condom, one sex act, then you discard and then you wash. So the condom use, if even you are using it, it should be done well. It should be done well.
And that is to put it on an erected
penis. Very important.
For the expiry date.
Expiring date before you use it. And it should be used at least every sex one condom. Okay. Because some adolescents will say that some adolescents will say that, oh, we can use it, remove it, wash it. I remember I went to a school, I won't mention the name, and then I made them to write questions on the paper. And one question was, Madam, can we wash condoms? And I said, it means that she has done it before. It will not protect you. So you have used the condom, but it's no use.
But I think it could also mean that she's probably curious.
That's how they are. And whatever question they ask you, they mean it.
Yes.
That is one thing about young people. What? They have explored and they want to know. Okay. So when an adolescent asks you a question, it means there is something that she needs to know.
Okay.
Yes. So use abstinence and then condom and regular checkups. Regular checkups. Sometimes some people say know your partner well. It means the one you are having the sex with, you should know him well. But how sure can you know him well? You can't be sure of that. So these are some of the preventive measures. And you said when you are pregnant, seek for antenatal care early. Some of these things can be picked early and then you are helped, like HIV, syphilis. There are things that we do. If you are pregnant, it's a must. So we do for you. If you have such infection, we pick it early and then you are treated.
Okay, so how accessible are STI kits for testing? Like, is it something that you can walk into a pharmacy and get tested, or do you need to go to health centers to be able to access STI kits?
For STI kits, I say they are very accessible. Like when you talk of HIV and then syphilis, you come to ANC, you don't need to even pass through the OPD. You come, we have something we call voluntary testing and then counseling. So you come, you tell us that, oh, I feel that I have this, I want to check for. Sometimes you don't even need to tell us, oh, I want to check for HIV, I want to check for syphilis, and then we do it for you there.
Okay.
So there are some that you don't even need a lot of energy. You come and then we do it for you. And then we have some that you have to go through the labs.
Okay.
Like the gonorrheas, you need a lab technician to just do it well and give you the right information. So with that one, you go through the labs.
Okay.
But with the HIV and syphilis, even if you come to the RCH, we can do that for you.
Okay.
And it's free of charge. You don't pay anything for HIV and syphilis tests.
Okay.
It's free of charge.
Okay. So HIV and syphilis are free.
It's free of
and
charge.
Where Tamale Central Hospital,
Yes.
if you want to do an HIV.
Yes.
So let me just retrace this. Madam says HIV and syphilis tests are free when you come to the Tamale Central Hospital. So young people, you would want to take advantage of that and then go and get tested and know whether you have syphilis or HIV. There are counseling sessions that are available after each test that I think that they can before and then after the whole test. So take advantage of that and then go and get tested. So HIV and syphilis are free, but how affordable are the other tests?
With gonorrhea and then the other types of STIs, if you have insurance will cover you.
Health insurance covers STI testing.
Yes.
Okay.
Health insurance should cover you. Gonorrhea tests, it should cover you for that.
This is news to me, and I'm very, very glad to hear this, because a lot of times when we interact with young people, they say, well, I wanted to get the test done, but then I do not have money to go and check if I have STI.
The problem we have is that, depending on the facility we are going, if it's not friendly, that's why I always say that for Central Hospital, we are passionate about young ones and adolescents. So we open up to them to come. So depending on the facility, if it's not a friendly area, the fellow may not come to the hospital. They go to the private labs. And private lab, you cannot have it done there for free.
Okay.
So I think maybe it's how we should make our facilities more friendly for the young ones to come to us so that we help them.
Okay, and I'm very glad that we have you from Central Hospital making this case. So if you are watching and you're a young person, if you want to get an STI test done, I think that Central Hospital is the place to go. Madam is assuring us of friendly youthful service and all of that. So Central Hospital is the place to go. Yeah. I didn't even know that the health insurance covered STI tests. So I think that this is a welcoming news. Before we wrap up, another thing I want to know is testing for STIs. Are the procedures so invasive? Are they very difficult things people are asked to do to get tested?
No. We have the high vaginal swab. We just put in, it's just a soft cotton around, it's just a soft kind of thing, and then we swap your vagina with it. It doesn't even go deep. You don't even feel anything. And then we have the lab blood samples, like the HIV and then the syphilis.
Okay.
We just take your sample and then it's done.
Okay, so you mentioned vaginal swab, so I know that is for females.
Yes.
So what of males? What do
for
they do?
male, we just have to take your the discharges coming. So we just hold the penis and then we swap some of the fluid coming up. Then we put it in a bottle. Then we send it to the lab. So it's not any
invasive procedure. So it's pretty easy to get tested. Okay, so before I leave, I have airtime to give out to people that are watching us. So if you are using Vodafone, today is your lucky day, and Fastest Fingers gets to have this. So the numbers are as follows: 5106 77 80 85 94 53. I repeat: 5106 77 80 85 9453. That is Vodafone. So if you got that, kindly let me know or indicate it in the comment section. I would greatly appreciate that. So madam, before we go off, your final words to young people.
I will say that thank you very much for this opportunity. I always say that people that have the young ones in heart are the best in the world, because they are vulnerable and they need information, they need help, they need knowledge, they need understanding, they need support. And I always say that if you give us this platform to help young ones, then God in heaven will bless you. So thank you very much for this opportunity. And I will say to the young ones, don't let people deceive you. Don't let people lead you astray. You are all that your parents have. Look at the hustle in the north. Parents are paying fees. Some are borrowing to pay your fees. Why will you let your life go astray? How much can a man give you to have sex with? And I always say that after the sex, do you know the implications that will come? Do you know the future implications? I have a lot of young ones that their uterus have been removed because of something they did wrong. And if they had had the right information, maybe it wouldn't happen. So if you are watching us, please listen, learn, and listen and be wise. God bless you all till we meet again.
Okay, so thank you very much, Madam. But before I leave, I would like to reiterate a few things Madam said. So I found out today, I was today years old when I found out that health insurance actually covers STI test, and this is a very exciting news for me, because a lot of young people would always complain about not being able to afford testing fees. That is why they do not test for STIs. But today I am told that the National Health Insurance covers the STI test, and if you are in Tamale, Tamale Central Hospital is actually assuring you of friendly youth services, so you can go there and get your test done. And finally, I'm giving my last call credits, and it's still Vodafone, and the numbers are 41017482941261. I repeat, 41017482941261. So this brings us to the end of today's program, and I'm very certain that we've all learned some very good lessons here. Thank you very much, Madam, for taking time off your busy schedule to be here with us today. We are very, very grateful, and the information you gave us today has been very insightful.
Can I leave my number?
Oh, sure. You can leave your number so that
they can call.
Okay.
So 0244 436326. 0244 436326. You can call me for any questions.
And the name?
Miriam.
So Madam just left her number. Her name is Miriam, and if you call her, maybe you are too shy or you are having problems locating the place, I'm sure that she'll be of an assistance to you. Thank you very much for that too. So I want to say a very big thank you to you, the viewers, for tuning in today and staying with us till this point. I am very grateful. This is a learning process for all of us, so I'm always happy when we can all share the knowledge. I also want to say a very big thank you to my crew members. Without them, this program would not come your way. Fatal, Solomon, they are behind the camera. Thank you very, very much for making it possible for this to be streamed live on our platforms. And also, I want to say a very big thank you to the people that worked on the sets. I am very, very grateful. So until we come your way, same time next week, it is bye for now.